With this is Dr. Tory McJunkin. He is CEO and founder of the Bladder Centers of America. He's an expert in neuromodulation, specializing in spinal cord stimulation, peripheral neurostimulation, and sacral neuromodulation. He's going to be going through what is happening for people with Parkinson's in terms of bladder issues, and then common treatments and treatments that are available for you. So I'm excited to introduce Dr. McJunkin, and I think this is your first time in our NeuroLife Online, correct, Dr. McJunkin?
Yeah, it's my first time. Thank you for having me, Anissa.
Awesome. We're very excited to have you. So I'm going to hand this over to you and let you get started with the presentation.
Thank you guys for tuning in, and I am excited to talk to you guys about bladder control and specifically about how it affects Parkinson's. My name's Tory McJunkin. I am a physician here in Phoenix, Arizona. So if you guys live anywhere around here, I'm happy to see you or talk to you guys. So the first thing I'm going to jump right into this presentation. Of course, if you guys have any questions, I think we're going to have a Q&A time at the end. So I would love to hear any questions, any comments, any of the things that I mentioned. If you've ever tried these things, I would love to hear your feedback. Okay, so I'm going to jump right into things here. So today we're going to talk about regaining control in people with Parkinson's. And the first thing I'll say is for most people, it really feels like this little image right here. And I think just life in general feels like that. But when you're, if you have any other kind of physical condition, it really starts to feel like that battle uphill. And I think Parkinson's is certainly one of those conditions that starts to affect, obviously, movement. We're going to talk about that a little bit, but then it starts to affect other systems. And so many of the people I see, including a lot of the Parkinson's people I see, they are actually like, hey, you know what? I'm actually doing pretty well with some of my movements. I'm dialed in on my medications. It took a while to figure it out, but they figured it out. I've taken care of several people who've had, deep brain stimulators, and what an incredible difference that technology makes for many, many people. But bladder problems actually affect a really significant part of the population, and they really affect your quality of life. And they're much more common. We're going to talk about this, but they're more common in people who have neurodegenerative conditions, including Parkinson's. So I'm going to tell you just a little bit about, a hypothetical patient that I have treated, although I've treated several that are very similar to this. Well, let's say we have a gentleman who is in his 70s, and he's like, you know what? I have Parkinson's, but I'm pretty well controlled. Having said that, I'm a little unsteady on my feet, and I'm having to go to the bathroom all the time. That means at nighttime, at daytime, I'm like really frustrated because I'm scared I'm going to have a fall. I've had one in the past year. And then if I don't make it, I will have an accident. So that is a very, very common person that I talk to. The first thing that we're going to talk about is what are the common symptoms of a bladder problem. So that's our first question for you. What are some of the symptoms of a bladder problem? And I mentioned a few of them there, but I just want to pause for a moment and have you start thinking, like, what are some of the things that you can think about, either that you yourself might have or somebody else who might have. And then I'm going to jump into some of the most common ones that I hear. So some of the ones that I hear are, I feel like I'm going all the time. We call that frequency. What is considered normal is going less, and this is in a 24-hour period. So this means the day and the night, but less than 8 hours in a 24-hour period is considered normal. So if you're going more than that, then that would be an increase in frequency. Urgency is another really common symptom that I hear, and oftentimes it goes like this. As soon as I feel like I have to go, I start walking, and then boom, I just can't quite make it. And so that would be a significant urgency associated with what's called incontinence. And incontinence is where you're leaking any bit of urine. And then a really, really terrible one for people is nocturia. If those other ones weren't bad enough, nocturia, going at nighttime, really destroys your quality of life almost faster than anything else. So I'm very passionate about helping people to restore natural sleep, because if they can sleep better, their body has the capacity to deal with all the continuous threats that we have. So looking at this in a list format, let's see. Okay, there we go. So we said sudden urge to go to the bathroom, that's called urgency. Frequency, going more than 8 times a day. Nocturia, I didn't tell you what was normal there, but getting up 0 times a night or 1 times a night is considered normal. If you're getting up 2, 3, 4 times a night, that's abnormal. Incontinence or having accidents is also considered abnormal. And then if you're wearing a pad, a diaper, a guard, a shield, those are other signs that something is not right or something is abnormal. Okay, and then one of the common things that people talk about, and I'll let you again think for just a moment on this question, but what are some of the activities that you might have to give up if you have a bladder issue? And this is kind of some of the things that most people don't think about. So when you have Parkinson's, some people might be able to see it in the way that you move, the way that you walk. When you have something like a bladder issue, oftentimes you feel drained, you feel out of control, but nobody knows it. It's kind of behind the scenes. So I'll show you what some of the activities that people talk to me about that they've kind of given up. So exercise is a big one. I was at a Parkinson's conference just this last week, and it was interesting because it sounds like one of the things that's basically agreed upon by almost all the experts is exercise is one of the best things that you can do for any neurodegenerative condition, but specifically for Parkinson's. And oftentimes people with a bladder problem, because if they stand up, they might have an accident, or if they start exercising, they stop exercising, which really starts to make the aging process and the kind of worsening process just to progress so much faster. Obviously, they feel like they're giving up control. Going out with friends becomes a common problem where they're just not hanging out or socializing like they used to. Traveling is a big one. And this is the fun part of what I do, is we get to see people re-engage back into their lives, back with their families, traveling. One lady that we just treated her not too long ago, but I saw her and I'm like, how are you doing? Because it had been a little while. And she's like, you know what? I've gone on 3 different cruises since you were able to help me. And that was just so rewarding to hear that she's engaging back in life. Sleeping through the night, sexual intimacy, confidence, peace of mind, all of those things really are affected by bladder problems. And then I would say compounded if you have something else like Parkinson's on top of that. Okay, there is an excellent book called Lies My Doctor Told Me, that's written by a doctor. But specifically in this world, in the bladder world, what we commonly hear is, if you have a bladder problem, it's just something you have to live with. Oftentimes you might hear there are no other options. Maybe that's what happens when you have kids, or this is a normal part of aging, and then, nothing can be done. None of those are really true. And I kind of categorize all those under lies my doctor told me. So today, what I would like to focus on are, what is the root cause? What is causing this bladder problem for most people? And then how can we address and treat the root cause? So, a lot of medicine focuses on the leaves or the symptoms, but not really like what's the underlying root cause. Today, we're going to talk about the root cause. And I think you guys, it'll be eye-opening for a lot of you. And it will just make sense with what's been going on for you. Okay. So one of the, common questions that I always ask, if I'm talking to groups of people, are like, how common are bladder problems? And so I hear anywhere from what I usually hear is really common, which is true. But I hear anywhere from probably 10% of people to 90% of people. And certainly there's some truth in there. It does affect, somewhere in that range. But what I will say is bladder problems are one of the most common problems that there is. And generally they tend to affect about 1 in 3 adults as we get to be 65 and older. And as we get older than that, 75, 85, it becomes much closer to 1 in 2, meaning, it's very, very close to almost everybody is getting some degree of this problem. Okay, so 1 in 3 is generally a good frame of reference for adults. And then what that equates to in America, the most common problem we call it overactive bladder. And it basically is a cluster of symptoms, all of the things that we already talked about, actually. Frequency, going too many times a day, urgency, not having enough time to get to the bathroom, incontinence if you have an accident, nocturia, going to the bathroom at nighttime. And so those are very, very common in the general population, but also very common in the Parkinson's population. You don't have to have all of those symptoms to be considered, this condition, overactive bladder, but instead it's many of those that people have. And so it might be, like I see some people, it's just nighttime. At nighttime, they're totally out of control. They have this condition called overactive bladder. Overactive bladder affects 50 million people just in America. So this is a huge, huge problem. And you can see the little diagram if you're able to see the illustration there. But normally the bladder is a muscle, and it's stable. And so we will talk about just a little bit. There's really a twofold purpose of the bladder. The overactive bladder is really just firing off too many signals. And so we're going to talk about why that occurs, the root cause of that. This is important. I kind of discussed this, but this is what the research shows. The research shows that if you have overactive bladder, your quality of life is just as badly affected as if you have rheumatoid arthritis. And so the image there, so somebody with rheumatoid arthritis, and obviously that's a condition where your small joints, medium joints, and large joints are all attacked by your own body. It's an autoimmune condition. But what we know is that affects your physical function, how much pain you have, your general health, your vitality, the sleep you get, the social impact it has. And what we know, the mental health aspect, what we know is bladder problems affect you the same as if you had a condition like rheumatoid arthritis. And obviously some people have both of those things. But so what that means though, is this is an important thing for us to recognize as individuals, and then to try and optimize as, I would say, individuals who have this condition and potentially as physicians. Okay, so the bladder really has, twofold purpose. And really, the first purpose is we want to store all the urine that's being made. And then 2, we want to empty the urine. And so with Parkinson's, you can actually have problems that arise in both of those things. So the storing of the urine and the emptying of the bladder. And we're going to talk about that a little bit more. But the best way to think of it is there is a disconnect between the bladder and the brain. So remember, the brain's kind of regulating a lot of this stuff behind the scenes. That's called the autonomic nervous system. So it's all just happening without us really thinking about it. But those things are affected in Parkinson's disease. And if the bladder doesn't fully empty, so sometimes we're getting the signal, hey, it's time to empty. If it doesn't fully empty, oftentimes these people are prone to urinary tract infections. We didn't talk about that as a common bladder problem, but it certainly is. It's one of the most common problems that people see a physician for. Okay, so this kind of complex diagram on the left there shows a bladder, and then it shows all the different connections that go through the spinal cord and up to the brain. And basically, there is a really complex symphony happening behind the scenes without us knowing it, where it's maintaining our bladder tone, preventing our bladder from contracting when it's not supposed to, and then allowing it to contract when it's supposed to. If any of that complex symphony gets interrupted, we start to have problems with the bladder. So on the right is a much more simple diagram, but basically what it's showing there is a highway of information going up from the bladder and a highway of information going down. If anywhere on that highway there's an accident or a jam, then we start to have problems with the bladder. And that's what we're going to look into just a little bit more here. So I told you we would look at the root cause of, the most common bladder condition. And so the root cause, I don't know if anyone can understand what that little picture shows there on the right side, but I'm gonna have you guys look at it. So that picture is a picture of an illustration of a nerve. And so what we know for this overactive bladder condition is the nerves aren't properly functioning. And so it can be the nerves inside the bladder, and often those nerves are stretch receptors, so they stretch and send off nerve signals, but those nerves can get inflamed or damaged, or it can be the nerves going from the bladder through the spinal cord and up to the brain. Those nerves can also be damaged. So, the very simple takeaway, one of the simple takeaways from this whole thing is if you have a bladder condition, oftentimes the underlying root cause is a nerve problem. So now we're going to talk about if that's the underlying problem, what are some of the potential treatments or therapeutics that can be beneficial for people? Specifically, let's look at people with Parkinson's. So Parkinson's disease, as you guys know, I would say, oftentimes better than me, most people think of Parkinson's disease as a movement disorder. And we know that there's a special little area in the brain that makes dopamine, and this gets decreased in people who have Parkinson's. And it basically equates to people with a movement disorder. Having said that, what most people don't know, and my assumption here for you guys listening, is that you guys actually understand this far better than many physicians, and certainly better than a lot of your friends and family. But Parkinson's specifically also affects the autonomic nervous system. And so remember, this is happening, it's automatic basically, and it's happening behind the scenes, but it's affecting blood pressure, heart rate, temperature, digestion, sexual function, and bladder control. And one of the first symptoms oftentimes we'll see with people with Parkinson's is even before they're diagnosed, they'll have like a history of having constipation. And so that means the digestive system the autonomic system is not working properly. Okay. So an overactive bladder, that is, the number one condition, affects 50 million people. In Parkinson's patients, it affects somewhere between 38 to 71% of people. So remember, in the general population, we said it's 1 in 3. In the Parkinsonian population, it is above 1 in 3, and gets further along than 2 in 3 at the high end. And so we're going to look at, remember I showed you this same little graph where there's the brain, the spinal cord, the peripheral nerves, and the bladder. Parkinson's actually affects and gives you this condition for 2 different reasons. And so I'm going to go into those in further detail. Remember, the overall concept is the nerves aren't functioning properly. And in this specific case, oftentimes it's the autonomic nerves. But let's look in further detail what's happening for people who are suffering with Parkinson's. See if I can, there we go. Okay, so number one is the central nervous system. And we said that Parkinson's oftentimes is just described as a condition where you have less dopamine. But what we know, as dopamine levels fall, we have a decreased ability to inhibit or suppress the micturition reflex. And the micturition reflex is just the reflex like, hey, the bladder's full, it's time to go to the bathroom. And so what's interesting is all of us right now are getting that signal. Hey, I think it's time to go to the bathroom. It's time to go to the bathroom. But our reflex is saying, calm down. It's not the time. We're trying to listen to this. We're trying to learn something. And so I often think of this as like maybe a toddler. And so the toddler's out of control and the mom's like, hey, don't go near the road. Don't do this. Don't do this. And so that is the micturition reflex, and it's inhibiting the idea that you need to go to the bathroom all the time. In Parkinsonian patients, as those levels of dopamine begin to fall, this reflex gets decreased, meaning the toddler is on their own. The mom's not there watching the toddler, and the toddler getting into all sorts of trouble. And so that's how I think of the central nervous system effect with Parkinson's. Not only that, but remember, it affects the peripheral autonomic nervous system as well. And so what happens here, again, normally there's a balance, and it's perfectly balanced in our body. And this balance begins to get out of place where there's unopposed impulses that cause the bladder muscle to contract. So not only do you not have, the mom telling the toddler, hey, relax, don't go near the road, but now all of a sudden you're just getting these impulses to contract. And so it's almost like a twofold problem where it's the central nervous system and the peripheral nervous system or autonomic nervous system that are both causing issues for people with Parkinson's. Oops, I double clicked there. Okay, let's see. I can't help it. I'm so fast. Okay, sorry guys. Okay, this is my only slide. I think I might have one other slide, but gut health, and we talked about this, this could be one of the early indicators for a lot of people with Parkinson's, but gut health and gut motility are also regulated by these kind of similar nerves that affect the autonomic nervous system, and that helps a healthy gut with healthy movements of kind of your food going all the way through towards the exit, and healthy gut motility. If that gets impaired, oftentimes the first sign that we oftentimes will see is we'll see constipation. Sometimes we'll even see fecal incontinence, where it's kind of the opposite. You're just out of control completely. Both of those are oftentimes related to the nervous system, a nerve issue, like we said with the bladder. And so this is really interesting. I think this is an area of medicine that's continuing to grow, and I think it's fascinating in my mind. But what is very interesting is you and me are more bacteria than we are human cells. And so what that little slide shows there is we have about 100 trillion microbial cells and only 10 trillion human cells. So almost like 10 to 1, we're outnumbered. And we have all these little bacteria, and it's actually bacteria, some viruses, and some fungi that make up that flora that we call. And so you have a skin flora, a gut flora. But what we know in Parkinson's patients is that gut flora in particular, and we're starting actually to learn more, there's even a flora inside your bladder. We used to think it was a sterile environment. We don't think that anymore. It's called the urobiome, but we're learning about that. But these things get out of balance, like we mentioned before. And so on the right side, you'll see in Parkinson's disease, you have an increase in GI disturbances, decreases in GI motility, which causes constipation. This affects somewhere around 79% of people, and oftentimes will lead to pain. But what this is doing is it's slowing down the trafficking of food and bacteria inside your gut, and then that leads to something we call dysbiosis, but basically an unhealthy gut microbiome. And so one of the things that your doctors might have talked to you about is, hey, let's try and create a healthier gut biome, take probiotics or eat certain foods or kefir or yogurt. All of those things we're starting to learn, all of those things have a huge effect on every single medical condition that there is. So whether it's Parkinson's, Alzheimer's, dementia, or chronic pain, anything that there is, really it's affected by our healthy or unhealthy microbiome. Okay. Over time, what generally happens for people who have these conditions is over time generally, and it's just like any condition, I think entropy, the second law of thermodynamics, that we're kind of progressively, things over time, the wheels are falling off the bus over time for you and me. And so what that means is we need to fight against that as much as we can to stay healthy. So now we're going to talk about what are the options for help for people who are suffering from bladder problems. And I'll start at the very kind of basic things and work my way up to, I would say the more advanced things and the most successful thing. And that will sort of in the major discussion, and then we'll have a Q&A. So here's some just healthy tips for you guys. Anyone can do these things. Even if you don't have a bladder problem, you should probably be doing these things. I would say the first one there is staying hydrated is important. It's difficult for people who wake up frequently at nighttime to go to the bathroom. So oftentimes they are in a continual dehydrated state. We're learning more and more about hydration and specifically electrolytes. So I always recommend when you're staying hydrated to do that with some version of electrolytes, because that's what keeps the fluid there. A healthy weight might be beneficial for some people. And we know that the more weight that each of us carry, we're starting to think of fat as as its own organ, and it's an inflammatory organ. So it actually is just inflaming everything else, whether it's your bladder, your brain, your gut. And so that would be one encouraging thing for each of us, is the more we can do to maintain that healthy weight, the better that we will be. Exercise probably goes hand in hand to some degree with trying to control a healthy weight. But that is one of the ways that our body can fight off oxidative stress. In the bottom left there, there's, not eating, I would say, processed foods, fast foods. I think there's more and more research coming out on vegetable oils or seed oils, that those may be causing lots of different problems for us as people, because our bodies were not made to break those things down. And so they really cause a lot of oxidative stress, and they inhibit how well your mitochondria work. So I always encourage people to eat more natural, healthy foods. And so, believe it or not, that probably means butter, avocado oil, olive oil. Those are probably much healthier alternatives than margarine, like we were told when we were younger, or canola oil, those kinds of things. So what you'll find though is almost all processed foods are filled up with those vegetable oils. The latest studies show the vegetable oils stay in our system for over 700 days. So they stay in our system for about 2 years. Our body can't break them down. They cause they wreak havoc on our every system in our body, but there's more and more evidence saying that these are really culpable for a lot of problems that we have. Medications. So some medications will make bladder problems worse. Water pills is one that I hear all the time. I'm on this water pill for my blood pressure, and now I'm peeing all the time. And of course, that's what a water pill does. You just want to make sure that you're not taking that before you go to bed, because then you're going to have miserable sleep. Oh, let's see. Sorry. The last one, avoiding alcohol, tobacco, any of those kinds of things, I think is really smart if you're struggling with any of these things. Okay, so the next thing, what most people do is cover the symptoms. And so basically this is like, I don't have a problem. And some of it is great. I'm really happy that we have diapers and all these different products, because it really does allow people to continue to engage in life. But what is interesting, you guys will find this fascinating, I think it's interesting, is the global adult market is much, much, much bigger than the pediatric diaper market. And so I'm going to ask you guys the question. I'm not going to tell you the answer, but I'm going to ask you the question: why is it that the global adult market for diapers is so much bigger than the pediatric market? So I want you to think about that, and you guys can comment on why that might be. So clearly this does not fix the problem or help the problem. It just covers the symptoms. So there are some, physical therapy or pelvic floor exercises. I would say women have heard of Kegel exercises, but that basically is just contracting and relaxing those pelvic floor muscles. If you have a bladder issue, I think that's a fantastic thing to do. Obviously, that works on the muscles, not so much on the nerves, but indirectly the nerves go to those muscles. So the stronger those muscles are, the better the nerves should work. So that's always something that I encourage for people. I would say for a lot of people who have a bladder problem, even if they do aggressive pelvic floor exercises, it's just not going to do the trick for them. Their nerves are kind of too far gone. There's something else called bladder training. And really, it's kind of brain training. But let's say you go to the bathroom every 15 minutes. You might set your watch, I'm going to go every 20 minutes. And then I'm going to hold it just a little extra to train my brain that I can't just listen to that signal. I have to go all the time. So for some people that can be beneficial as well. Let's talk about medication. So medication, are kind of, what a lot of Western medicine is founded upon is, you have this disease, we have to give you you're deficient in this specific molecule, and we have to give you this molecule, and it's going to help your symptoms. So we're going to talk about the medications for bladder leaks. I think for many people, this is the most eye-opening part of this talk, maybe. But here are some of the common bladder medicines. And so you guys might recognize some of those. Ditropan, Detrol have been around a long time. Vesicare, Mirbetriq, Gemtesa are the two newest ones. That cute little guy there, the cartoon, he's supposed to look like a bladder. And they have a commercial on TV for this little guy, Mirbetriq. So the two newest ones are the most specific. Maybe they have the least potential side effects. They're also quite a bit more expensive for a lot of people. Specifically, for people with Parkinson's, those bottom three are probably the safest versions. I'm going to tell you why. But if you have to be on one of these medicines, the bottom three would be the ones that you would want to be on potentially over the other ones. So Vesicare, Mirbetriq, or Gemtesa are the three ones that likely are the safest for people and have been studied in people with Parkinson's. So when we talk about medicines, really we care about two things. We care about, do they work? And so that's called efficacy. And then number two, we care about side effects. Like, are these going to have side effects on my life, on my quality of life? Are they going to cause downstream side effects? So let's look at those things. So we have this thing in medicine called number needed to treat. And basically what it means is how many prescriptions do I have to write before one person does really good? And so an example, let's say that you go to the urgent care and you have strep throat and they write you an antibiotic. The number needed to treat for me getting that antibiotic for my strep throat is pretty close to 1. They just need to write me a prescription and usually it'll work. So, there's probably a 90 to 95% chance that that medicine is going to work really good for my strep throat and I'm not going to end up in the hospital. The number needed to treat for these bladder medications is closer to 8 or 9. And so what that means is I have to write a prescription for 8 people before one person does really good. And so that looks at efficacy. Can you imagine if you had strep throat and you go and they're like, yeah, here's an antibiotic. There's about 1 in 8 chance this is going to really work great for you. That would not be what you wanted to hear. Unfortunately, that's what many of these medications actually have, including our new ones. Their number needed to treat is about the same as the older ones. And so what that means is these medications are not terribly efficacious, okay? That they're not terribly effective, but that doesn't look at side effects. So now we're going to look at side effects. And so the biggest one is it looks like that older class of medicines really increase your risk of dementia. So we don't know 100% if they cause dementia, but we know they drastically increase your risk of dementia. And we think they increase your risk of dementia by about 150%. And so, which is, mind-boggling. And what we know is somewhere around 10 to 15% of the dementia in the Western world, America, Canada, England, so on and so forth, is from these medications, meaning likely the people would not have gotten dementia unless they were on these medicines. That is really scary. These medicines also tend to make people feel dizzy, confused, drowsy, have brain fog. And because of that, they really increase your risk of falling, and they increase your risk of fractures. And so falling and fractures become one of the greatest risks for adults over 65, and it's something all of us should be trying to avoid, specifically with Parkinson's, because there is a movement disorder problem. The risk of falling is drastically higher in those people. And so these are some of the medicines you might want to avoid. Again, I will go back and just show you if you were going to take one of these medicines, which one likely have been studied better than the other ones for people with Parkinson's, because it's important for you guys to understand that. Vesicare has been studied fairly well. That's the third to the bottom one there. It does not cross your blood-brain barrier, so we do not think that one probably increases your risk of dementia like some of those ones above it. Mirbetriq and Gemtesa, the two newest one, likely do not increase your risk of dementia. They have a few other unique risks, including heart arrhythmia. But if you're going to be on one, those would be one of the 3 that you would want to be on. Okay. If you didn't have to be on one, that would be even better. So here's a huge study that comes out of England. There's almost 43,000 people. They're all started on these kinds of bladder medications. And then if you look at that graph, you'll see what happens over time. Basically, people are drastically coming off these medications. And so the reason is exactly what we talked about. 1, they don't really work that well. And then two, they have a lot of side effects. So what this study shows is out of a study of 43,000 people, about 85% of people quit these, little more than 85% quit them because they're not working and they're causing side effects. I talked to a woman last week or the week before. And so she has been one of the older classes of medicines for almost 10 years. And so I was asking her, does that medicine work for you? And she's like, I don't know. I just take it. And then she's also telling me that she's kind of developing some signs of dementia. And so one of the goals that I talked to her about is, one of our big goals is let's see if we can help you with your bladder problem. And I'm going to talk to you guys about that. But let's also get you off that medicine. And those medicines, the older ones really dry you out. That's how they kind of work. So dry eyes, dry mouth, drier bladder is the idea. And so they might have an effect where they kind of dry out the brain and cause some of those side effects. So then really the question becomes, if the medicines aren't that effective, if they don't work, what can we do? So what about surgery? There's a couple different kinds of surgery that I kind of listed on here. So there are surgeries, there's things called prolapse. So if part of your body comes out, and that you can have, women can have a uterine prolapse or a bladder prolapse or a rectal prolapse. But if you have part of your organs that come out, oftentimes you need surgery to put that back in. A more common kind of procedure is called a bladder sling. So many of you, I'm sure, and sorry, this is for women. Many of you have probably heard of a bladder sling. This treats a version of incontinence, not the kind we've been talking about, a kind that's also very common, but a little less common, and it's called stress incontinence. It happens more frequently in women after childbirth because those tissues start to relax. But basically what this does is it uses mesh and it pulls up the urethra, which creates a little kink there. And normally we have a sphincter that creates the kink for us, but as the hormone relaxin is made during pregnancy, it relaxes that sphincter, and then you start to have leakage when you laugh, cough, or sneeze is the big thing with that. So if you don't have any of the things that I mentioned and you just have, laugh, coughing, and sneezing leaking, then a bladder sling could be the answer. And it has a long-term success rate around 90%. There's a newer version, an injection that came out in the last few years here in America. It's been out in Europe for a little while. So that would be the one that I would probably recommend if it were my, wife or mom, rather than a bladder sling, because it's a little less invasive. For men, oftentimes if they have a bladder issue, we're considering, is it their prostate that's causing this problem, an enlarged prostate? And so for men, oftentimes what's done is called the cystoscopy, to take a peek inside and see if the prostate is obstructing the urethra or closing it out. The oldest procedure is called a TURP, where you go in and open that up, and basically it's a roto-rooter and you ream out the prostate, try and create more space. There's some newer versions, UroLift. There's one where they shoot water there. There's a couple different versions to try and create that space. For men, oftentimes we'll see that they develop, I should have mentioned this, but bladder problems are a little more common in women. But for men, we'll see oftentimes they've had this procedure for their enlarged prostate, but they still have a bladder issue. Now we're like, oh, this is their bladder, not their prostate causing this. And then for men, the other thing we'll oftentimes see is after they've had prostate cancer and they have radiation, surgery, chemotherapy, oftentimes those nerves will get damaged, like we said, is the root cause, and then they'll have a bladder issue. So there really isn't a great surgery is the point of this slide. I'm sorry, I rambled on, but the point of this slide is there's not a great surgery for overactive bladder. If it's another condition, there might be something that can be beneficial. In surgery, we're always wondering what is the risk versus what is the reward. And we want there to be a really nice balance where the reward is better than the potential risk, because we all have friends or family who have undergone some kind of surgery and all of a sudden they have a new problem they didn't have going into surgery. So what I'm going to talk about right now is, what can be done. Remember, we talked about this is a nerve issue. There's not great surgery. There's not wonderful medicines for most people. Physical therapy can help people, but oftentimes isn't quite enough. What is a wonderful solution? And I want to take a pause here and have you guys just consider in your own minds, if you were creating a solution, what would you want in that solution? So I'm going to wait a second. I'm going to have a drink while you guys are thinking here. So I think what you guys would want is you would want something that works really well, right? You want it to be long lasting. You want it to be effective. You want the side effect profile to be minimum, kind of like all the things we talked about, the reverse of those things to some degree. So what do you want in a solution? Well, you want it to be safe. You want it to be relatively simple, like not some big invasive, reconstruction procedure. You want it to work on the underlying problem. Even if it doesn't fix the problem, you want it to really target that underlying problem. Specifically, we said the problems that the nerves aren't communicating very well. There's a disconnect between the bladder and the brain. I didn't mention this, but it's a good one. You want it to be covered by insurance. Some people will say affordable. You want it to be long lasting or durable. So you don't want something where you're going to have to do this every 3 months or every 6 months the rest of your life, because that might become cumbersome. Okay. And then we said we wanted something really, really effective. So the therapy that I'm going to talk to you guys about works for 93% of people. And specifically, this is, what I specialize in, but it's called sacral neuromodulation is the fancy word. The non-fancy word is this is called bladder stimulation. And as I explain it to you, it's going to kind of make sense like why this is kind of the, best therapy. The number needed to treat on this is pretty close to 1, meaning for each person we treat, we expect that this is going to work. Okay, here's a couple people. And this is what I hear very commonly, and I really like this. So I feel a lot of people say, I feel like I got my body back, or, meaning they feel like they have got control again. I hear a lot of people say this feels like a bladder miracle. I love that one in particular. Okay. And so remember, we wanted to treat the underlying problem. The underlying problem in this scenario is the nerves really aren't working on that well. So I'm going to talk to you about why this therapy tends to be the very best therapy that there is right now. So there's 2 steps to it. The first step, and this is actually really cool. I didn't mention this, but this is cool. You can try this therapy out and see if it works for your problem. So that's pretty rare in medicine. In medicine, let's say you're going to have a knee replacement. You don't know if that's going to help you or hurt you. I would say most people do pretty good, but there are a lot of people who don't do well. This therapy, usually, it's a trial and it takes 10 or 15 minutes. And what happens is generally you lay down on your belly, an X-ray machine comes over you. You can do it with or without light sedation. We numb up your skin, place 2 tiny little needles just above your tailbone. And we slide when we get close to the little target nerves, which are the sacral nerves. And so specifically, it's either the S3 or the S4 sacral nerves. When we get close to those nerves, we slide in a teeny little wire that's very, very flexible and about the size of a guitar string. That little wire gets left behind, the needles come out, that gets taped to your back. And then externally, we hook in just a little tiny battery. And for the next couple of days, we turn on just a teeny bit of electrical energy and you watch and see if your symptoms feel better. Most people starting that evening, let's say we did it, at noontime, starting that evening, they'll be like, "Oh, I can kind of feel when I have to go. I'm not rushing to the bathroom. I'm not having accidents. I feel like I'm in control again." And then at nighttime, let's say you're getting up 3 or 4 or 5 times a night, we want to see you get to a normal 0 times or 1 times a night if we can. So that this works for 93% of people. But what we see on average is the average person gets about 75% reduction in their symptoms. So if you try this, you might get 75, 85, 95, 100. And all of those things are really, really good. So I encourage people, like if we can get 75%, you should be really happy about that. At the end of those 3 days, there's a sticker on your back. We peel it off, pull the little wires out, and you figure out, is this the right therapy for me? If you absolutely love it, a week later, we will implant a little battery. You can see what that looks like. It's a little longer than a quarter and more narrow than a quarter. I'm going to hold one up in my hand so you can see what it looks like. Well, it's okay. I'll hold it compared to my hand. This little battery is FDA approved for 20 years. It just keeps working and working and working for you. And basically it's sending, and let me explain how it works because we kind of dance around that. Sending just a teeny bit of electrical energy to those nerves. And what that ends up doing is it opens up the highway of information between your bladder and your brain. So this little device does not tell your brain when you need to go to the bathroom. Instead, it allows your body, your bladder, to tell your brain when it's time to go. And so it opens back up that feed control loop in your. So a similar technology, I would say much more advanced than this, is deep brain stimulation for a movement disorder. And that is also this same field called neuromodulation. This is the version that is for bladder problems. That implant procedure, takes anywhere, I would say, from 25 minutes to 45 minutes. That little battery lasts for over 20 years. It's hooked into a little bigger wire that looks like a spaghetti noodle. Everything's under the skin from that point on. It is MRI compatible, so if you have, which is really good for Parkinson's patients. So if your doctor wants an MRI, they can still do that. It's very simple to turn off. If you have a deep brain stimulator device already, you can still get one of these things. And so one of the common questions I get, and again, I'm happy to take any questions about any of the things that I've mentioned, but one of the questions we get is like, well, if this is so wonderful, like, why hasn't my doctor told me about this? And the real reason is because most doctors don't know about this. And so medicine is advancing so quickly that if you have a primary care doctor, they can't keep up with all the literature in primary care. And so most doctors, that's why a lot of doctors will really specialize in something, because they're an expert in that particular field. So this underlying technology has been out 25 years. It was kind of updated in the past 4 years and has been drastically improved. One other thing I should mention, because I really hit this on the medicines, is the side effects. It's important for you guys to know if you're thinking about something like this. The biggest single risk is there's a 1% chance of infection with the implant procedure, where there's a little incision that's made on your body. So that is the single greatest risk with this procedure. There are a few other things. That little lead we talked about can move if you're in an accident or a fall. And so there have been a few of those. The risk of that is probably somewhere around 1% and maybe greater than that if you fall like frequently. Beyond that, there's never been any cases of nerve damage. It's not in the spinal canal, so it's not next to your spinal cord. It's next to those small peripheral nerves, but there's never been any reported cases. There's been about 200,000 of these devices done around the world. Okay. So, to sum things up here, what we discussed today is that really the number one cause for most bladder problems are a nerve issue. And specifically for that condition, overactive bladder, it's a nerve issue. That's the underlying issue. If we want to have success treating that, we have to understand that this is a nerve problem. We also discussed in Parkinson's in particular, it actually affects the central nervous system, high up and low down at the peripheral level as well, or autonomic level. So it's kind of unfortunately, a 2-for-1, where these people have a higher tendency to have this problem. Having said that, this therapy, one other thing I thought of, but this therapy is, the single best research, best solution that there is right now. And I expect for the, foreseeable future, because it really targets the underlying issue, the nerve issue. One other thing that I failed to mention, but it's important, this device is FDA approved for overactive bladder or urge incontinence. It's also FDA approved for fecal incontinence. So if you have all the time or time to time have uncontrollable bowel movements, which is also very common, affects around 20 million people. This device tends to work well for those people. What is very interesting about it is it brings things back more to norm. So if you have overactive bladder, you're getting too many signals, it brings you back down and calms things out. If you have urinary retention or underactive bladder, it brings you up to a norm. And so what's interesting is people with constipation, now it's not FDA approved for just constipation, but people who have constipation, it will help to speed up that bowel and oftentimes help out with the constipation as well. So if you have a bladder problem, you have Parkinson's, this could be a really nice therapy that actually affects your GI system as well as your urinary system. Okay, I think we are winding down. The, I guess, final kind of ideas. Remember, we talked about quality of life. The research on this shows it drastically affects your quality of life. And so in research, there's a minimum for how much we say, oh yeah, that affects your quality of life. this blows that out of the water by 300%. So that just means it really helps almost every area of your life, your sleep, how you feel about yourself, your coping abilities, socially, and overall. This really has great research showing it will help you. And so I would say if you have this problem, this is a progressive issue for most people. It's something that you likely should take action on. And there actually are, some pretty good therapies for that. I am in Phoenix, Arizona, and then that's my website, Bladder Center, if you want to learn anything more about us. But I would love, that's the end of the whole presentation. I would love for any questions, comments, or to hear about your own experience. What are things that have worked for you?
This has been fantastic. I don't know if you have a chance, you could unshare your screen. We love to be able to see everyone's faces as we're having this part of the conversation through the questions. And we actually have had a lot of questions and we don't have a lot of time. So I'm going to try to pick out some of the ones that kind of touch on the various things that you've covered. So going back to some of the medications that you had reviewed, you mentioned Gemtesa, if I'm saying it right. This
Yes.
person had mentioned I'd had Parkinson's and overactive bladder problems. I've tried Gemtesa. I got a UTI at the same time. Is that one of the risk factors of having a UTI, or was that a coincidence that they occurred at the same time?
Yeah, that's a wonderful question. So it does look like most of these medications, including Gemtesa, do increase your risk of UTIs to some degree. And so, it might be one of the things, if you got a UTI from Gemtesa, then maybe that's not the right one for you. Having said that, if I was gonna pick one medicine that had the best research, that's probably the one that has the very best research. But yes, they do increase your risk of UTIs.
And when you're talking about the nerve issues, is that the same as a neurogenic bladder?
That is a wonderful question as well. So there is like a true neurogenic bladder. So let's say somebody has a spinal cord injury and like they're paralyzed, their spinal cord is actually not working. That is what we consider a neurogenic bladder, where they're just not getting signals really at all. And so, what I've been talking about, overactive bladder, is not necessarily considered a neurogenic bladder. If you have a spinal cord injury, this therapy has not been FDA approved, although there have been some cases that have been done, and some people have done well with that. Okay,
There,
yeah, go ahead.
oh, I'm sorry. There was a question about is there any role, does the vagus nerve play any role?
Yeah, so that is a great question. So the vagus nerve, kind of ends up more in the gut than it is in the bladder. But indirectly, the vagus nerve, we think there's a high probability that it's responsible for some of, Parkinson's, maybe even all of Parkinson's. And so I would say, there are some things. The vagus nerve really helps to control that balance between sympathetic and parasympathetic, or your autonomic nervous system. There are specific devices for vagal stimulation, actually, but so I would say indirectly it does play a role. Directly, probably not as much.
And I actually just got this question, but had it earlier about is the role of botulinum toxins
Uh,
in
yeah,
bladder? Is
yeah,
that
wonderful.
a treatment option?
Yeah, wonderful question. So, botulinum toxin, or Botox, as probably most of us know it, is a treatment for the exact thing that I mentioned, overactive bladder. And basically, it's an injection. You go in through the urethra and you inject 20 different spots in the bladder. And what that does is it paralyzes. It's a toxin. It's a neurotoxin. So it paralyzes the muscles. Unfortunately, it's one of the therapies that needs to be repeated frequently. So usually at least every 6 months, kind of the rest of your life. For some people, it can be quite effective. Generally, it's not as effective as what I mentioned. Like on Botox, what you're looking for is about a 50% improvement. On this, we're looking for at least a 75% improvement for what I called sacral neuromodulation. For Botox, the big risk is it can put people into urinary retention where their bladder's not fully contracting. And so it really, one of the big risks it has is that You might have to catheterize yourself, and then it predisposes you to getting urinary tract infections because your bladder's not fully emptying. If you have a painful bladder condition where you have all this, plus you have a painful bladder called interstitial cystitis, Botox could be a good choice for those people. But again, you have to repeat it frequently.
And I know you've referenced sort of DBS, as a treatment, and we've heard that often said it works, but we don't know why it works or how it works specifically. Do we know how this is working?
Yeah, so I would say indirectly we know how it works. I think almost everything in medicine, like we can say, oh yeah, it works like this. But then as we drill down, there's probably 10 layers that we don't understand at all. What's interesting on this, the research on this actually goes back 100 years. And they actually they did experiments on dogs that had bladder problems and figured out that if you stimulate these little nerves, it opens back up the communication. But there are people who get their PhDs just in this. And so I have talked to one of them for quite a bit, trying to understand this more deeply. And so what you quickly realize is like, we just don't understand a lot. But one of the concepts though, is that you have all this kind of static, all these signals going all the time. This kind of calms down that signals, the too many signals, where just the right signal can get through. And I think that's the best that we understand it right now.
All right, and I think we have time for one last question. And I'm going to pair this question. They want to know the name of the stimulator. And I know you reference things that are covered by Medicare. Is this covered by Medicare?
Yeah, great question. So it is covered by Medicare. It's written into the Medicare guidelines. And so you have to fail conservative care. You have to have had your problem chronically. So it can't be something that developed in the last week or two. You have to have tried some other things. You have to have tried things like Kegel exercises. You have to have tried at least a medication. And then essentially you would qualify to do this. So as long as you meet the criteria, it's covered by insurance and covered by Medicare. Anissa, I'm trying to remember what the other part of that question was. Oh, the company. Okay. There are two different companies right now that make this technology. There are some other ones that are investigating, looking into this space. Medtronic is one company. They invented this space. They've been out for 25 years. And so they actually have a lot of research. Their research tends to be older when they first came out with the device. The technology that I primarily use is called axonics. And so axon means nerve, but it's axonics.com. Their research is a little bit newer, and at least right now it appears that their device is the superior device if you kind of read through the different research. Having said that, there are some people that respond really good to one and not the other one. But was there other questions at all?
I think that'll do it. Anissa got kicked off. So,
Okay.
but we are at the hour, so we'll go ahead and wrap up. Thank you so much for your time, Dr. McJunkin. And we have a tradition here at PMD Alliance that at the end of our live streams, everybody gives you the wave of gratitude to thank you for your presentation and your time today. So thank you.
Thank you guys too. Yeah, God bless you guys. Thank you.
Thanks. Have a good one.
Bye-bye.